I wanted to show everyone this post-op that we did. We talked about this case on our YouTube channel already at the beginning of January. We did the surgery in February, and here we are at the post-op. I wanted to review what our plan was, how it went, and what had to change. Overall, the surgery went really well. We did have to make some game time decisions, and we did have to change the plan just because during the surgery some complications or some issues came up. I wouldn't say there were complications. Overall, the patient did amazing. He's super patient, and he didn't even need sedation. He seems to be a very calm person to begin with, and he takes pain. He doesn't get anxious about pain. So our initial plan was that to do this in 2 stages. We wanted to place 5 implants in these positions, and we were going to restore him to second molar occlusion on the right. And the reason for that was not because we wanted a second molar occlusion, it was because we wanted to have him occlude on the molar here and the molar over here to hold his bite, and so that way the bite doesn't collapse while he's healing. We even wanted to keep this premolar here, so that, again, to hold the bite, have him something to chew. However, that had to change because we needed this first molar position for an implant. So again, this is stage 2, what we were planning to do. We were planning to remove the green stars, meaning the first molar here, the premolar here, and this wisdom tooth here, and then restore him to this with 2 bridges. However, we weren't able to do that. Moving to the actual day of the surgery and the post-op, we had to remove that first molar because we needed that first molar position, and there was no reason for me to wait in 3 to 4 months. And then removing it and then placing another implant would extend his timeline, and I really didn't want to do that. So instead I left the wisdom tooth on the top left. What ended up happening was that we could not get access to the second molar position. There was just not enough room for the drill or the guide. We couldn't freehand it, and then we also still had to do a sinus lift, and it became too difficult in order to get access to it. So instead, we removed the first molar. And keep in mind, the teeth that we removed had issues that we saw on the CT scan. The radiologist made a note that there were apical infections on all of them, and he declined. He wanted to do these implants instead of any other option, and we talked about all the options. So we ended up doing this first molar position, and I'm very happy with how it went. We freehanded it because it was not part of the treatment plan. So when we freehanded it, I had it as a backup plan, as plan B. So I did look at the sinus distance from the septal bone to the sinus floor. It was around 9 millimeters, and between the CT scan and real life, we know that we have an extra 0.5, maybe even to 1.5 millimeters of bone than what is noted in the CT scan. As a result, right at 8.5 millimeters of depth, when I was drilling into the septal bone, I checked, there was no perforation. After that, I removed the individual root tips. So when I do immediate upper molars, I always cut off the crown, and whatever is left, I will drill through it with my osteotomy drills. And if there is a perforation, then I can do a sinus lift right away. If there isn't a perforation, then great. It's a great way to measure your depth. I'll explain more once we see the video. Upper left was the challenging part. We did not get great primary stability on the first molar position just because there was just so much infection. So we had to do a sinus lift there. We cleaned out the socket first before we did the sinus lift, so I'm not pushing more bacteria up into the sinus. We used a Crestal Approach sinus kit from Hyosyn. Super kit, really well, worked really well here. The difficult part was the depth. It was just so deep, and it even looks deep on this Panorex. Once I show you the post-op, it's more than I'm more than happy with it. There was a loss of buccal plate and all the posterior positions that we placed the implant, so we had to do the membrane and bone graft periosteal stabilizing suture, membrane stabilizing suture with the periosteum. We had to do a periosteal release in multiple areas just to try to close. And it was a very tough case, especially the posterior, just because access was very challenging. But I'm glad we were able to get it done. We used a surgical guide for only 2 teeth, which were the premolar positions, and that was it. The canine position could not use the guide. There was too much infection, so the guide didn't even reach, like the osteotomy drill couldn't even reach where we had to go because it is a 15 millimeter implant. And we didn't perf into the sinus floor or the nasal floor, so I'm happy with that. We did our free-handed temporary on that canine as well. I'm hoping that we can restore it with screw retained implant bridges. I'm holding my breath on that. Let's see how it goes. And we may do the same with the quad 1. We might do them splinted crowns. I mean, just because he's got such a strong bite that I'm worried that if they were single positions that contact might open up between them. I'm not sure, and I don't want to risk it. I don't want to risk mobility in him. He's going to be on a soft diet for the next 3-4 months, and I'm hoping that wisdom tooth will hold on and be able to hold the bite until then, because he is a very strong retrognathic mandible. He is a class 2 division 2. Looking at the 1 week post-op, we can see all of the healing abutments here and there, so I am happy with that, meaning it will be a little bit easier to restore. I do expect the gingival tissues to look more like this one in about another 2 weeks or so from this photo. And after a week, I normally irrigate it with saline, and then I will palpate it with finger pressure on the buccal and lingual just to see if there's pus or bleeding coming out. Thankfully, none of that happened, and the temporaries at the premolar and the canine position were still solid. I had to take this one out of occlusion on the day of the surgery just because I knew that he would be chewing on it, and I don't want to risk losing this implant because he's lost an implant on the anterior before, and we didn't want that. What did go really well was our team just ran like clockwork. We knew exactly when I asked for something or the game plan changed to plan B, we knew that we had to switch out a few things, get longer implants, and we made it work, all things considered. The patient was super patient. He was very calm, which made it so much easier because he barely even moved and he wasn't even sedated. It was incredible. I told him exactly what we needed to do. When we had to do the sinus lift, he said, okay, do it. And we did it. No issues, no feeling of pressure or liquid in the nose, so that's a good sign. Overall, I'm very happy with this, how it turned out, how it's going right now. I'm looking forward to seeing how he heals and restoring for him as well. Hopefully we will be able to help him with the bottom teeth too, just because there's so much going on there. I'll update everybody once we get there. If you have any questions, advice, comments, please let me know. I'm always willing to learn, and always willing to share what I learn as well. Thank you so much for listening and watching. See you in the next one.